So, hi and welcome everyone. This is Nilachal, and I welcome you all on the second meeting of this Health Connect community where we are discussing the research papers, the research roundtable, and I welcome you all. Due to some technicalities, a few things happened, but again, I'm here with you with the article discussion. So I welcome you all again on this second meeting of Research Roundtable organized by HealConnect community and initiated an initiative by Live Holistic Wellness. So I welcome you all again. Just to start with, I want to show how the Discord functions. So we have made one group in the Discord where we are actually discussing and sharing our views and how the things happen. So the community is built on Discord, so we can have a general conversation. Those who are not new to Discord, uh, you can get a glimpse how it can be. So I'm just giving a brief idea how the Discord community of HealConnect community functions. So we have made a group in Discord, which is a very popular social media platform. We may not be using, but this is a very popular social media platform. And in this Discord community, we are sharing all the discussions, all the papers, all doubts that we will have. So here is the platform where we will discuss everything. So here there is general information where all the information related to the research papers will be shared, discussed when the dates are announced, when the event will be here. So this is 18th March. So we are here with the meeting 2 with article 2. And just I want to go with the basic idea of this Heal Connect community is to discuss the research papers related to health. Health is the wealth. The ultimate wealth is the health. So this community discusses more about the researches based on health and whichever area it is. For example, I'm starting with the yoga therapies, how yoga therapy is helpful in building health. So we are starting with this health, with the research papers related to yoga and health, and the every research paper will be based on these research papers published in indexed journals mostly, so that we can have an authentic reference for the papers. And this whole discussion structure is based on a 20 minutes discussion, including the introduction and agenda setting, introduction of the journal and authors, description of the article that we select, and in this we need your suggestions also to give the research papers, to suggest the research papers that we should discuss, in-depth discussion of the chosen article for 8 minutes, then the introduction, methodology, which will include all these things. Then we will end with the results and discussion, and at last the critical appraisal of the study, which is an important part, and it is based on the listening of and the understanding of the research paper that is being presented, and an open for discussion with the question answer and the closing remarks. So this is the whole structure that is being formed. So this is the second meeting, so I'm discussing it again so that we can have a general idea of this Health Connect community, where we will be discussing more of the health related research papers. So I welcome you all in this Health Connect community, and let us start with our article of the day. So welcome again to the Heal Connect community and we are in the research roundtable, and this is an initiative by the Live Holistic Wellness, which talks about the health. So, in this second article of HealConnect community, we are discussing. So, my name is Nilachal. Sorry, I didn't introduce you with me. So, my name is Nilachal. I'm a founder of Live Holistic Wellness Institute, where we try to focus on holistic health, physical, mental, social, and spiritual wellness, and we focus on individualized therapies. And there is a institute where we try to heal people, we try to enable people through the yoga therapy. And I'm also a research scholar in Institute of Self-Genesis and Complementary Medicine of Sri Balaji Vidyapeeth University in Pondicherry. So this is the basic introduction of me. So I'm more of a kind who tries to figure out the health aspects, what are the health therapies which can help to improve health and wellness. So let's move further. So in this second article, we have the paper with the title Yoga Clinical Research Review. And this is the paper published in the Complementary Therapies and Clinical Practice. We'll discuss more in the upcoming slides. So let's talk about the journal. So the journal is index journal, which is the name of the journal is Complementary Therapies and Clinical Practice, and it is a very good journal because of the impact factor. It has impact factor 3.26, and the publisher is Churchill Livingston and of United Kingdom. So an index journal is a journal which is indexed is said to be good or bad based on the impact factor and how many times it has been read by the authors or it is cited, and all those features actually lead to a good impact factor. And journals with two or more than two impact factors are considered to be good. So this complementary therapy in clinical practice is a good journal. Now let us come to the description of the article. So this is a basically research review article, and the topic of this whole article is yoga research review, which discusses mainly of the researches being done in the field of yoga. So the author is Tiffany Field, who is affiliated with the Torch Research Institute from the University of Miami School of Medicine, and she has discussed in detail with uh, the study of yoga in different fields, different sections of the medicine, different areas of the life also, different age groups also. So this is a review paper which discusses what the researchers had been done in uh, field of yoga therapy or yoga in different areas. And in this paper, this is a review of the empirical studies and meta-analysis also on yoga that has been published over the past years since 2010. So it is not uh, very old, but it has a very good impact since 2010. How the yoga has been impacted in the field of health, and we all know that 2014 was the year when the International Day of Yoga started to happen, and we all celebrate International Day of Yoga from since 2014. So it was before that how the yoga was being impacted, how yoga was taken into consideration, and this is a good paper in that sense. The areas which this paper include are pregnancy, prenatal and postpartum depression, stress, PTSD, anxiety and obesity, cardiovascular conditions, which includes the hypertension, pain syndromes, including arthritis, headaches, and low back pain. Autoimmune conditions include asthma, type 2 diabetes, and multiple sclerosis. Immune conditions including HIV and breast cancer, and aging problems including balance, osteoporosis, and Parkinson's. So, the lot of uh, different fields has been selected in this paper. So, it is a very vast paper, and I will just try to summarize what this paper brings for us. And it is not enough to discuss all these things in 20 minutes. So if you are seeing it in any other platform, this then the teams, MS Teams that we basically are doing, then it is like a request to all you. If you are going through this paper, then please give us feedback or give your suggestions, give your observations, analysis on this paper, and let us know what we can discuss in this paper more. So, in this is a and there in this paper, many analysis has been done, and one of the bibliometric analysis that has been done from 1967 to 2013, the authors noted that they included 486 articles that had been published in 217 different peer-reviewed papers. So it is a huge number, and 217 different peer-reviewed papers, reviewed journals. And the participants who participated in this research were a huge number, 28,080 participants from 29 different countries. So they reported a threefold increase in the number of publications in the last decade, and this may be because of the uh, celebration of International Day of Yoga, and people are more interested or more aware of this fact that yoga is also a lifestyle. Yoga is becoming popular, apart from being it has its roots in India since bygone days. And also in this analysis, the author reported that more than 200 titles were added to the literature review every year. So this is also a uh, very good achievement in a way that every year, 200 titles are being reported for in the name of yoga. And the areas focus on the pain, stress, anxiety, depression, and cancer. The methods that has been used in this study is they have conducted a review of recent research of the effects of yoga poses on different areas, which include the psychological conditions like anxiety, depression, pain syndromes, cardiovascular, autoimmune, and immune conditions, and pregnancy, as they mentioned in the introduction. So they have conducted reviews separately for all these areas, and they have brought the meta-analysis and observations on that. And it is reviewed a physiological effect like decreased heart rate and blood pressure, physical effect like weight loss and increased muscle strength. So, they have reviewed different areas of the uh, different areas like the physical, psychological, physical, and other areas related with health, and they have bring out some reviews, and they have given us a very good results in the way that taking into consideration for the students' physical fitness and cognitive functions, they have shown a very good results that for the students of different sections, for example, the grade school students, the tension and cortisol level decreases, the strength has increased, and there were not the movement and cognitive skills were also equal, how they have compared with the physical education. Emotional health has increased. Similarly, emotional sensitivity are also increased. GPA has also increased. Stress has reduced. So this is for the grade school till this portion. For the high school, if you see the emotional regression has increased, GPA has increased, emotional sensitivity has increased, and stress has reduced. So, as the educational institutions increase the pressure in a way that students and the uh, students from grade school to the university, they have a lot of burden with them, and yoga therapy and yoga helped them with a very positive manner. So this is observed with these results. For the graduate school, they have reduced school physical fitness and flexibility, if you say. So they have increased the flexibility. They have improved the balance, muscles strengthening, stretching was found to be equal, spinal mobility, muscle endurance, and all this emotional well-being. This is one of the very important aspects which we can address. Like positive effect were observed on its emotional well-being. So these were the results where the uh, the researches which are done with yoga with students of different sections, students of different classes or grades, grade school, high school, and the university and graduates. Now, coming to the second areas where this review has been done, that is the pregnancy, to where the pregnant women are made practice with yoga, and what are the conditions they have observed. So, in pregnancy, the exercise intensity has uh, helped in the help in the mobility. Exercise helped in the movement of the uh, different body parts. And further, there was no change observed in the fetal HR and contractions. And if you see, the pain has reduced, fetal circulation and growth has increased, anxiety, depression, and cortisol level also decreased, and some other areas uh, the similar kind of effects are seen. And there is one more importance that the pregnant women faces are the sleep deprivation that has also found to be improved and for during the pregnancy and postpartum. It is very much helpful for the women after the postpartum. So they have depression and anxiety decreased during the postpartum. Now coming to the next uh, category of the review, so that is the stress and psychological conditions that have been improved by yoga. So, as we have seen in previous reviews, that the psychological conditions were improved. So, definitely here also all the things were improved in different uh, research papers. So, 47% muscle pain and stress were improved with uh, yoga. The sleep quality has improved, levels of antioxidants have increased, positive psychological, physiological balance is observed, sleep disturbance has reduced, stress, anxiety has reduced, depression, PTSD has reduced, alcohol and drug use. This is very good observations, good results that has been seen that yoga also helps to reduce the alcohol and drug use, anxiety, heart rate, the anxiety has reduced, panic sensations reduced. Both yoga groups they have found to be reduced. So another overreacting that it develops the prefrontal cortex. So there has been an sympathovagal changes where the parasympathetic activity are becoming more balanced with the sympathetic, so people are able to just give more awareness of what they are eating, how they are eating. So overeating and leading to obesity, they have an impact on the these conditions. The cardiovascular conditions, so the pre-hypertension conditions, so systolic has decreased, diastolic, so these are being improved. High density lipoprotein has reduced. So there is a balance in the cholesterol level that we have seen, uh, and in the hypertension also it has. But in the hypertension, there were no such differences being observed when done with exercise. So this is one area that there was no difference found when yoga was being practiced and exercises were being done. Now coming to the pain conditions, pain syndromes. So pain syndromes like the arthritis. So positive physio outcomes were observed. Pain, swelling, and stiffness has reduced. So the knee osteo uh, condition, if you see when it was done with the exercise, uh, the walking pain, it is good that it reduced. Pain and sleep problems also reduced. So it helps to relieve the pain in the knee. Now coming to the neck pain and headache. So when it was compared with the Pilates, neck pain when it is practiced with the Pilates, no differences were being found. Maybe because Pilates also have the similar kind of practices like the asanas, and the researches that has been practiced with the Pilates and yoga, uh, the intervention may be related with the mostly with asanas. There are more practices like the Brahma Mudra and other practices related with the breathing, the yogic breathing techniques, the chanting. That if had been done, it would have been found more differences. But here the practice was done with basically with the asanas. So no differences were found. Headache, there when it is practiced with when is compared with the medication, headache was found to reduce. But since there are different headaches, so there can be a lack of some specific headaches that has to be mentioned. Then the premenstrual pain, it was found that there were some changes in the alpha waves and cognitive functions with the premenstrual condition and premenstrual pain and when doing the yoga. And in terms of back pain, specifically the low back pain, with exercise the pain has reduced. Serotonin and bone maker, these have increased and gray matter also increased. So this is a very good improvement in the low back pain was observed in the researches. Now coming to the autoimmune conditions. In this paper, they have found some research papers. They have mentioned some research papers where yoga helped in autoimmune conditions like the asthma. So in asthma, they have found that there has been increase in the FVC and FEV, and they have decrease in the leukocytes. So it has improved the condition of asthma in that when the basic practices are being done, the some uh, different cleansing practices are also advised. Then the COPD has improved, type 2 diabetes has also improved, multiple sclerosis was also found to be improved, irritable bowel, and chronic fatigue. So this was found to improve, and there were no differences specifically in multiple sclerosis were found when it is compared with the aerobics, usual care exercise, not that uh, this is exercise walking. So when multiple sclerosis is compared with exercise walking, it was found that there was no differences. Similarly, irritable bowel syndrome, no difference was found. But in chronic fatigue, when yoga was being practiced, the fatigue was reduced. So this is a good improvement with yoga. Immune conditions again, what help yoga has been done till now. So immune conditions like cytokines, HIV, pediatric cancer, breast cancer, and colorectal cancer. So in all these conditions, yoga help in a supportive role, and it has uh, so there are different phases of the disease we can see. One is the psychic phase when the things are in our mind. Then is the psychosomatic phase when the disease enters our body through the mind. Then there is a somatic phase, and the last phase and in the last phase, the problem is non-curable. So this cancer and other immune conditions are in that category where nothing much can be done, and the conditions can only be improved with the practice. So yoga helped in that conditions, and it helped significantly by different parameters. As you can see, the epinephrine level has decreased, serotonin has increased, quality of life has increased, depression has, anxiety has decreased, fatigue has decreased, pain has a lot of uh, balanced. Depression, sleep disturbances were being observed and it was improved. And so this way how the yoga has helped in different kind of cancer. So pediatric cancer, the depression, anxiety, and physical activity, anxiety, physical activity, and fatigue, they have improvement. Breast cancer, when it was compared with the usual care, there was increase. But when compared in one research, when it's compared with exercises, no significant difference were observed. So this all I will come this in the limitations when it comes. So there were no differences were found when compared with exercise. Similarly, aerobics, yoga is also aerobic practice. So like for we take much consideration of the breathing. So it also muscle strength was observed. Collateral cancer in colorectal cancer, colorectal cancer, the inflammation has anti-inflammation conditions were found with the practice of yoga, and sleep disturbance was reduced. And last but not the least, when the aging conditions were being observed with yoga, there were some findings with the research papers. So the movement, the walking, and the mobility has improved. The balance of the body has improved in the old age. Similar type of practice when done with Tai Chi, no difference were found. Balance was found with all the yoga practices. Sleep has improved. Depression has decreased. Osteoporosis conditions has improved. The bone absorption is improved. Sit to stand conditions has improved. In Parkinson's, so in Parkinson's disease, the sit to stand conditions were found to be improved. Diastolic blood pressure has decreased. When it was compared with the power training, there were no differences. And the respiratory function, when it is compared with the inactive, it helped. It showed a vast improvement. So from this we comes to a conclusion that this research paper has done a vast study of various researches in different areas of different age category, different health conditions, and lifestyle. So this is a very vast paper, and we need to go through each of the conditions separately. That would make more sense. But this is a review, and we get a glimpse of what yoga can do. So from that we can have a separate or individualized category where we can focus specifically on these areas where we can research or we can discuss more on that. So in this paper, this was this is a very vast study of vast review, vast analysis. The bibliometric analysis were very amazing. Like this is very tough thing to do. So history, compatibility, proneness, lifestyle, diet, and other aspects are considered in this structured clinical examination, and the role of lifestyle, occupation, and many other causative factors requires appropriate credit in this research. So, so there is a need to understand. There is a need to understand the limitations in this study. So there is a lack of randomization and self-selection of samples in some studies that was found, and variability in sample sizes. So in some the sample size was less, and some the sample size were more. But like the conditions, if you see for some immune conditions, so for example, some different conditions like the cancer, HIV, those patients will definitely be less. But in other conditions, the sample size can be increased. So those research papers were being also added in this review article. And there are many papers where physiological, biomedical, and immune measures were missing. So this can be done. And since the yoga has a very vast area, the practices of yoga are important. The tools of yoga therapy is needed to be taken into consideration, that what yoga therapy is offering. Is it asana? Is it pranayam? It is mudra? It is shatkarma. In shatkarma also what shatkarma? In pranayam also what kind of pranayams? If it is dharana practices, what kind of dharana? So these all things are needed to be addressed separately, and these all have different impacts as a yoga therapy or yoga chikitsa. So one is needed to do separately on these areas, because yoga therapy itself is a very vast field. If we see, this is the yoga, and if we take a small part of this, this is yoga therapy. In this yoga therapy also we can have a multiple areas of asana, pranayam, mudra, shatkarm, dharana, dhyan, and many more. So therefore, like each category has to be taken or should be taken separately, so that better researches can be done. And this study, they have shown this, and they have lacked some papers which uh, have been performed like that, and it was not been included in the review article, in this review article. So the future scope can be the more studies with randomized studies, randomization with larger heterogeneous samples and control groups can be taken. Standardized doses and inclusion of physiological, biomedical, and immune measures may be taken, as I mentioned earlier. And the mechanism research to integrate yoga into mainstream medicine, like how mainstream medicine and yoga can be, and it is now happening. So we can see much of these researches, and more practical software sessions designed for home practices can be uh, formulated for a better study, so that it can be more practical. So clinical advisor of the study, we are not going much into this detail. So since this is a review article, so they have very depth in that, so it was okay, and will give the critical appraisal of the study in upcoming research papers. And if you are watching, how you liked, you can give a feedback, or you can evaluate how this basic discussion were, and you can also suggest some improvement and how this can be done in more better way. And please join the Discord group, and be updated yourself with the upcoming activities of this HealConnect community. And I thank you all for listening till this end. Thank you so much. See you. Namaste.